Hello everyone, and I hope everybody is doing perfectly fine. Today I'll be just briefing you about a course which we are going to start. And before that, I would like to just give a brief introduction about myself. Myself, Dr. Manjari Kishore, and I have done my MBBS from Guwahati Medical College, Assam. And I did my post-graduation in MD Pathology from Kasturba Medical College, Manipal, Karnataka, Udupi. And post that, I did my senior residency from Dr. Ramanolia Hospital, New Delhi, and Lady Hardinge Medical College, New Delhi. After that, I worked as consultant in ESI Hospital, Rohini. And then I jumped into academics as assistant professor, and currently I am working as associate professor. And as you know, I already have my this YouTube channel, but then I thought like focusing on our lab technicians, MBBS student, postgraduate and senior residents, what we thought as a combined team effort, including biochemistry, microbiology and pathology, that we should start something new. Like we should start a combined basic course for all our students. And so before starting into a detailed module courses, we are starting with capsule courses. Capsule, you can say lectures. So it will be like 4 5 capsules, which we'll be giving you detailed information about certain important topics. और उसके बाद हम डिटेल में जाएंगे मॉड्यूल कोर्सेज के which will be over a period of 3 to 6 months. So in this, so just briefing you about the current this like because actually I had immense interest in research and publications also. I did more than 120 papers in various national and international journals. So, but I have a lot of interest in academics, and I thought, ki, yes, this is the right platform where we can impart or we can share our knowledge with you all. So, we are working as a team, including our biochem and microbiology faculties, so which we'll be introducing to you very soon. And today I'll be just briefing you about our Capsule 1 course, which we are starting on 2nd of Feb 2025. So it will be a course for 2 hours duration. So in this course, मैं आपको बस एक highlight देना चाह रही हूँ कि what we'll be discussing in this course. So basically, when see CBC बहुत important होता है. CBC gives you it acts like a window to the functioning status of our marrow, like how our marrow is doing inside our body. कैसा उसका functional status क्या है. So it is a window to it. So CBC जैसे आप जानते हो technician samples लगाते हैं हमारे बहुत because see they are a very important part in our diagnostic tests. So they are the one who can avoid the pre-analytical errors which are the maximum. So अगर हमारे pre-analytical errors जो processing के time पे ही अगर prevent किए जा सकते हैं, तो जो हम analyze कर रहे हैं reports को, slides को, so that will be very easy for us. So that's why I want this course to be like spread to maximum number of technicians so that they get a very lucid way or very simple way to deal with all these sampling methods. So what we'll be doing is we'll be giving you a live demonstration. हम आपको videos और recordings और live demonstration करके दिखाएंगे how you process sample, how you receive sample, how you process it in 3 part, 5 part, and उसके बाद दोनों के interpretation 5 part, 3 part में कैसे आप CBC को interpret करते हो. CBC हमें इतने सारे पैरामीटर्स देती है, and you know each and every parameter is so important कि you can correlate with the signs and symptoms of patients. So उसके बाद हम जाएंगे how you make a peripheral smear, how we interpret a peripheral smear, जो उसके sections हैं peripheral smear के, like how we report RBC, WBC, platelets, interpretation of different types of anemia, the catchy points क्या क्या होते हैं, where are the area where you can make errors, like in WBC, how you interpret normal WBC, abnormal WBCs, then thrombocytopenia and pancytopenia, then malaria filaria, common hemoparasites, how you are able to detect on peripheral smear, and most importantly critical alerts, warning signs. CBC में आपको flags भी मिलते हैं, आपको कुछ important parameters होते हैं which you have to remember, those are critical, very critical, and to inform the clinician as soon as possible. Then highlight of this course will be like how we can avoid common hematological errors so that we give a correct report, and the process becomes very smooth. We can avoid pre-analytical, analytical and post-analytical errors if we give a wholesome approach to this simple test. So I request all of you to join this course as much as possible so that we get a very good knowledge about this simple test, and we can very much correlate it with the patient. And once you are very much well aware with how we read a CBC report, how we interpret the peripheral smear, I tell you it is very easy to correlate with the clinical signs and symptoms of the patients. So if you have any doubt, the number is being projected here. So you can very much call here for any kind of a doubt.